is Ono Carl, and I welcome you to another episode of Oncology Spotlight. Thank you for tuning in. Our guest for this episode is Dr. Paul O'Brien, who's a medical doctor from Cork, Ireland. Thank you for joining us, Paul.
Cheers, on. Thanks for the intro, and thank you for having me on the podcast.
So, Paul, could you briefly introduce yourself and share a bit about your background?
Okay, so my own name is Dr. Paul O'Brien. At the moment, I suppose I'll work backwards in chronological order in terms of where I'm at in my career. So currently a medical trainee, so on the medical pathway, a first year BST trainee, so that means the basic specialist training. And I'm based in a tier 3 hospital in Clonmel in Ireland, where I'm doing a neurology rotation. Prior to all this, it's a little complicated to kind of unwind the past, because I've had, I suppose, a career outside of medicine before this, involving kind of food industry, regulatory compliance, and kind of very much orientated towards the Chinese market. I suppose that's something we'll, touch on later. But in medical terms, I'm fairly new to the field, but I suppose what maybe sets me apart is that I trained in China, studied in China, and then came in through China through the USMLE pathway, and then came through the Irish exams and managed to get a place in the Irish system, and have kind of solidified myself there at the moment.
Super. That's fantastic. What inspired you to pursue a career in medicine, Paul?
I suppose you probably know yourself the Irish hierarchy of kind of value system. The parents would have been, I suppose, a strong influence. They're kind of, this goes kind of the tier is the god and the priests, and then the doctor is somewhere above them or below them. But very much, I suppose, an influence on that side. And I have two sisters as well who'd be medics. So one is based in California in Palo Alto, or Menlo Park, actually. She's a bariatric consultant, so dealing with a lot of the issues around obesity and stuff in America. And then I have another sister was originally a GP in Ireland, but then she's kind of moved towards, I suppose, pharmacovigilance and kind of drug development pathway, working for ICON as their medical director around oncology products. So that's the main influences. And then I suppose my background, in terms of my academic background, I would have done genetics and then food science. And I kind of, I suppose, felt that I wanted a more hands-on job rather than research orientated. So it kind of, I suppose, naturally developed from there, and getting the feedback from the siblings was very important as well. So a lot of influences, really.
Yeah. And you trained as a doctor in China. Can you tell us a little bit about your journey from Ireland to China and back again?
Yeah, so I suppose it started initially after finishing my master's in food science and technology. I kind of wanted to travel the world a bit. So I kind of took a gap year after finishing my first kind of stint in academia, and I went traveling in Southeast Asia, and I settled in the northeast of China for about a year. And that was just kind of doing odd jobs, really, and doing mostly travel. But I got, I suppose, a great exposure to the culture, and I suppose a lot of the preconceptions we'd have in the West around China being filtered through a kind of Western media bias, those kind of preconceptions were kind of removed, and I saw a new kind of culture and a great exposure to that place. So that really, I suppose, it gave me a taste for what China has to offer. So I was living in Australia for another year after that, kind of a bit more, I suppose, standard for people in Ireland. And I kind of always wanted to go back. So I got the opportunity to go back as a regulatory analyst around kind of food science and technology and that area. And one of my big pastimes is I love playing football, and I met up with some footballers over who were actually first year medical students. And that's where my kind of, I suppose, the idea to study over there came
was it
about.
Difficult to get the access to the studies over there, or was it just like, how did that?
Not really, no. It's quite similar to the way foreign students would enter into China. There's a kind of minimum grade requirement around what you've done, and let's say you're leaving cert. And it's generally like you need what they would call the equivalent of a 1H or they use GPA. But once you're getting over kind of 70% on average in your leaving cert, it's just a case of paying the fee, and that's really it. Now there will be different tiers of colleges the same way every country has. So that's where things get a bit trickier. But I was in Zhejiang University, which is, I suppose, it's considered the third or the fourth best university in China. So quite competitive to get into, but at the same time, not as onerous as going through the, 600 points and what's that new test that the doctors have to do over here, the HPAT or whatever,
So I suppose on that, like it seemed like a big jump to like I know people who've gone within Europe to follow medicine. Like it seemed like it was a big jump to go to China and actually make the decision. Was it just it just the opportunity fell to you, or it was a decision you just wanted to stay in China to do it?
I think it was more so the opportunity fell to me. I'd be quite, I wouldn't, I suppose, if I feel an opportunity is good and there's a lot to, in terms of pros and cons, I'm weighing them up. I suppose the big thing for me was that my boss in the previous job in China, he was very receptive to me actually doing, kind of working remotely and studying at the same time. So that was obviously a huge factor, being able to support myself financially through the whole process and not having to turn around to the parents at 28 and say, can I, go back through this same process I did 10 years ago. So that was hugely important. So I think that probably made a big difference in that I didn't have to either take a big loan that a lot of students would have to do. And I was able to have a decent quality of life at the same time, which when you're 28 becomes a bit more important than when you're 17. You're happy enough to kind of muck it out. Yeah.
Okay, and I suppose so. You previously worked in food science and regulatory affairs. Where did your interest in food science originate?
I suppose I often find that the distinctions between the food and the pharmaceutical and all that kind of it can be quite arbitrary in the sense that I suppose what I'd be most interested in is actually things like molecular medicine. So I suppose looking at molecular pathways and I suppose getting increasingly granular or high resolution on what I suppose pathways are involved with disease processes and how either medicines or alternatively foods can interact with those pathways. And I suppose what are the points in a specific pathway we can target with either medicines or with food. So that was always something that was, I suppose, I was interested in, but I felt that it was quite difficult to find a pathway towards, I suppose, dealing with patients or dealing with people, like, because that's something I really like, is actually patient interaction and that side of things. So it wasn't really an avenue that was available to me in food science. A lot of the jobs were kind of lab-based, research-based jobs, or alternatively in Ireland in kind of meat packaging facilities or that type of stuff. So what wasn't really suited my personality either,
Okay. And I suppose that, as mentioned, like that career shift, like it came about through your boss and the work you were doing in regulatory within China. So
yeah. I mean, look, I suppose part of the advantage that I had in the regulatory side of things was I had a very good understanding of kind of basic sciences. So one of the key areas I was tasked with was actually content marketing. So scientific content marketing, if you're able to sell a good story, if you can, I suppose, a scientific rationale around things, it can help a lot. So that was one area kind of that helped me excel. And then I suppose the nicheness of what I was dealing with, I was probably one of only a handful of people who were commentating or offering kind of insights on the China market in terms of, I suppose, food industry market entry, regulatory requirements. And over time then, as I developed an understanding, I was able to kind of, I suppose, contextualize a lot of the changes and I suppose help international stakeholders de-risk market entry into China. And then it kind of morphed into offering more technical consultancy around infant formula and dairy and a lot of food for special medical purposes and functional foods. So there was a bit of synergism between what I was doing in the medical side and what I was doing in the food industry side as well.
Okay. And was it I suppose then the bridge across from that job, was it something you were looking out for, or the opportunity arose? Like, did someone did your boss mention it to you about taking up an opportunity in, I suppose, in medicine?
No, not at all. It was, as I said, it was very much kind of just landed on my plate. I was based in Hangzhou, and I had toyed around with the idea of going back to medicine in the past, but I suppose some of the key obstacles were the finances. I wasn't really happy. I was, earning a good living out in China, and I didn't particularly want to take a step back towards student life. So when I suppose all those things kind of aligned together, I felt like the opportunity was too good to, I suppose, turn away. And then I felt like, I suppose, with medicine, you're never kind of, short of opportunities. It's a great kind of primary degree to have on board as well,
Very good. The Irish Examiner, featured your contributions during COVID-19 crisis in China. Can you shed some light on the role, how your work made an impact?
That was a crazy time of my life. It's very surreal to look back on how everything, it was the kind of icing or cherry on the top in terms of, I suppose, it came at the end of my stint in China, and it kind of all seemed to fall into place in some respect. Kind of how it came about is actually through a colleague of mine, a Dr. Oisin O'Connell. He's a respiratory consultant based in the Bonds. I had written an open letter to basically the CMO of Ireland at the time. Just, I suppose, there was a sense of complacency around the COVID threat in Ireland, and obviously being a China commentator, I had better access to information on the health side of things, and then I also had the connections within the medical industry, in that I would have doctors who were actually stationed in Wuhan at the time, who were kind of like the alma mater, or the hospital where I did my internship. That was one of the key, I suppose, contributors for hospital staff to go into Wuhan. So some of the guys I knew would have either known someone or actually been directly there themselves. So I got feedback on that side of things. So I wrote the open letter, and then Dr. O'Connell reached out to me, and I think things all spiraled from there. So the first kind of step off point was we organized a emergency conference in the Bonds. So that was attended by the Taoiseach, Micheál Martin, and there was all sorts of different, I suppose, medical luminaries from all the different universities, and there was me not really kind of knowing how this all kicked off. So I think it was, to be fair, Dr. Oisin O'Connell was a great driver on that side of things to set it all up. And I suppose he also at the time set up a WhatsApp group, pulled in a lot of different people from, I suppose, very disparate areas of expertise, which allowed, I suppose, a great melting pot of ideas to form. So from there, kind of connected with HSE procurement around getting PCR testing machines. So I don't know if you remember, at the time in April 2020, a lot of the testing facilities were closing down. Basically, there was a lot of reagents. So I was able to work with a Dr. Paddy Mallon, Dr. Oisin O'Connell, and a few others in kind of the HSE procurement. And then in collaboration with the embassy here, the Chinese embassy, and then my colleagues over in the second affiliated hospital in Hangzhou, we got all the reagents and testing equipment, and that was announced in the Doyle and everything. It was a mad time. And in between that, then there was interviews in prime time, and it was mad. Like I did a load of things that I would not have expected.
All from one letter.
All from one letter, exactly. Yeah, it was mad.
Yeah. Wow.
Snowball effect, as they say.
Yeah, I was just about to say a snowball effect, but like no regrets whatsoever. I suppose the massive benefit to those in Ireland, really, in terms of information and kind of giving, I suppose, supports from China in terms of info.
Yeah, I think what it highlighted is obviously there was it was a contentious issue, any kind of interactions with China, given that there was, I suppose, a lot of disinformation, or whatever you want to call it, going around, but there was a significant, I suppose, negative sentiment around China at the time. But I suppose what it did prove is that, cutting through all that kind of noise, we were able to get something done that was very, very beneficial, and prove that without politics involved, things work very smoothly.
Yeah, okay, very good. So you're also a content creator with a strong social media presence. I suppose what type of topics do you typically cover in your videos?
My content creation was very much, I suppose, task orientated or job orientated. So when I was working in China as a content creator, my job was to actually create a sales channel or a funnel leads towards our business through scientific content creation. And I suppose the key areas we would focus on, as I mentioned previous, was the kind of dairy sector. That's a $25 billion kind of enterprise or industry over in China. And then I suppose a corollary of that is you have the food for special medical purposes. They're all very high value markets. So
Yeah.
it was very much around developing that as a channel. So once I left my role in the name of the company I was working for was Chemlink. It was a kind of subsidiary of Reach 24H, which is a big compliance company over there. I kind of didn't have a very, I suppose, I don't have a target anymore. So I've kind of moved away from it as such. And then I suppose with the demands of my medical career, I'm working 60, 70 hours a week at the moment. So I would like to be able to do more around the medical communication space, because I think it's hugely important that more doctors are, I suppose, visible online and are able to create, I suppose, more visibility for us and to be able to get the correct information out at the moment, because we're struggling as a people, as a species at the moment with the whole trying to, I suppose, figure out the whole social media space is
Yeah, I suppose especially with the disinformation that can I suppose can be out there.
yeah, it's huge. It's very political at the moment, and you just want to be able to make things not political and just be very, I suppose, evidence-based in our approach to scientific communication would be great. So it's something I'm considering doing, but time is a big issue at the moment.
I could imagine, yeah, especially in your post currently, yeah. And I suppose that puts us on the top of your recent LinkedIn post. You mentioned that how figures such as Gary Brecka and Brien Johnson's use digital content to manipulate audiences. Could you elaborate a bit on that?
Yeah, so I suppose individually, what I find about Gary Brecka is that he's clearly read the first chapter of a pathophysiology book, and that's his kind of, he's just reiterating a spiel that not necessarily incorrect, it's just quite basic.
Mm-hmm.
And then the kind of, I suppose, the tacit implication the whole time is that he has somehow got this level of secretive knowledge that no one else in the world knows, and that he's selling something. It's a snake oil pitch, and it's kind of classic for his type of influencer style on the internet. And it's kind of goes back to what I say around we need more doctors involved in medical communication to be able to, one, kind of contextualize this for the public to say, listen, this is not anything new. If you picked up a basic kind of first year medical textbook, this would be what you would read. And it's being able to, he's making jumps from kind of very basic pathophysiology into areas around treatment of cancer, treatment of, significant cardiovascular disease, always with the implication that medicine and the medical system is somehow nefarious and doing everything incorrectly, and that he's got the answer. And that's something you routinely see amongst that type of influencer,
Okay, very
and
good.
a bit more time for Brien Johnson. He's just, I suppose it's interesting in that he's kind of using himself as a guinea pig. So from an entertainment purpose, I can see more value to it, because he is, I suppose, expanding boundaries in some respects, but at the same time, there's always a sales pitch at the end of that as well.
Yeah. What is it? The oils. His olive oil.
And his chocolate.
His chocolate, yes. Yeah.
So
it's hard to find chocolate these days, all right.
It is, isn't it?
Yeah.
That's the problem I have, is not eating chocolate.
Very good. With your diverse background, what innovative approaches or policies do you think could help bridge healthcare gaps, especially in oncology?
Look, it's probably an area that I don't have enough expertise to comment on yet, but more broadly speaking, I think in the realm of chronic diseases, I think you definitely have a lot to do in the medical system. So I think there's a broad misunderstanding about what doctors' roles are and what we should be doing with patients. And I think it's important for us to let patients know what happens in an acute setting. And generally, if you're coming into hospital, you're sick, our job is to get you out of there either stable or better than you came in, and solve the initial issue. But generally speaking, I think a common what would you call it? A common complaint that's made by the public is that doctors don't treat chronic disease correctly, and that we don't have any training in nutrition, and that we don't understand, the basic kind of components of, metabolic health and factor control. Or actually we do. The issue is that the system constraints on us don't allow us to practice medicine like that. And I think that's important for people to know. It's probably incumbent on us to develop a system that runs in parallel with the medical system. I actually genuinely believe like management of the basic risk factors like blood pressure, cholesterol, glycemic control, can all be done probably by people with less training than a doctor, and probably that have more access to patients on a regular basis. Would be a great thing. And then with the whole area around apps and data, if we had more consistent generation of data, and we plan interventions, and then we have kind of feedback loops where the data is fed in, the interventions are planned, and then we've, let's say, a touch base in 1 month with somebody, and then the new data is fed in, we'd have much better control of things like, blood pressure. Because we do know that for blood pressure and, cholesterol and everything else, that managing these on a lifestyle basis is superior in many ways to medical intervention.
Okay, very good. And how significant do you believe AI has been in advancing medicine?
Have you used any of the systems yet? Are you using ChatGPT or?
I'm using it on a daily basis, and baseline emails, I suppose, improving emails as opposed to anything medical.
What I have seen now, and it's with increasing frequency, letters of referral I'm getting from GPs, I'm 100% sure that they're being generated by AI, right? Yeah. Some, like the programs nowadays, there's a couple of different ones. So have you heard of Heidi?
No.
So Heidi is basically like a transcription app. So you can, pop your phone down. It will do basically transcribe all the interaction that you have with the patient. You can dictate, let's say, the physical exam portion, but then it will take all the history and it will automatically generate something like a SOAP note or a clinic letter. I suppose what I find is always the interesting tell is that a lot of the differential diagnoses generated will be mad. You never hear them in daily practice. So one of the recent letters I got was a patient coming in with shortness of breath, and on the differential was, vape associated lung injury. And it was, one of these things. So I certainly see it being utilized. I think it's going to make things a lot better for us. I caution it around the HSE is that we still don't have an electronic health record system in Ireland. So the idea that we're somehow going to integrate AI into what? So it's going to be an uphill struggle for Ireland to integrate it. But even things as basic as triaging patients before they come in, taking histories, I think that would all be quite safe to do at this point in time. I don't think you want it making massive medical decisions, because we can see that it does make mistakes, obviously.
Yes, and that's the inherent risk, from it at the moment,
But just basic functions like transcription with oversight from either your any healthcare worker will be a great way to, I suppose, reduce some burden. And then I suppose longer term, I suppose it's really what data you're feeding into the system that's going to matter. But I suppose medicine is essentially just a set of algorithms in terms of how we manage things, and what manages algorithms better, a computer or a human, so I think the implications are obvious long term, but we'll see which way it goes.
I think it'll be very interesting in time, I suppose, from my own side, just seeing it from the data side, like large volume data sets, to be able to find the trends that are affecting patients in a bit more in detail, to find those trends in particular areas of medicine, such as oncology or I suppose heart disease or anything like that, respiratory. So Paul, thanks. That was a very interesting conversation, and thank you very much for sharing your thoughts with us. And I'm sure our audience will enjoy the conversation as much as I did.
Pleasure. Thank you for having me on the podcast, and hopefully it's somewhat of a valuable contribution to some people. Very great pleasure to chat to you, and sure we'll talk again.
Yeah, and thank you to everyone for joining us and listening to the podcast. We'll see you soon on the next one. Thanks. Cheers.